Mom's fine. Sometimes she forgets things. She's just getting older. Is she just older? Every adult, child, sibling, partner can help their loved ones and themselves by becoming informed. Get your bearings now and get ahead of this devastating disease. Alzheimer's disease. 1 in 3 people will be diagnosed with Alzheimer's disease by the age of 85. We will be discussing what is Alzheimer's, causes and risks, stages, diagnosis, treatment, care, and follow-up, prognosis, how we can remember, and how we can remember, and references cited. What is Alzheimer's? Alzheimer's disease is it is a neurodegenerative disorder marked by abnormal protein buildup in the brain, leading to memory loss and cognitive decline. It is beta amyloid plaques and tau tangles that begin building and then destroying cells within the brain long before disease is apparent. It is significant shrinkage of gray matter. It is neuron cell death. It is fatal and incurable. This is a picture. It's a rendering of beta amyloids and tau tangles. The amyloids are the orange, and the blue irregularly shaped tendrils are the tau tangles. Amyloid, taus, and what now? Changes in anatomy and physiology. Beta amyloids are protein fragments that clump and form amyloid plaques that inhibit communication between brain cells. Tau tangles are tau proteins which support and transport material within the brain that deform and reorganize into neurofibrillary tangles, tau tangles, that damage and interfere with brain cells. While a tau PET scan remains a reliable and accurate predictor of tau burden in the brain, the test's utility is limited by availability, low resolution, high cost, labor, and sensitivity. Unfortunately, not everyone who doctors think have Alzheimer's gets to have these tests. I know several people who have had Alzheimer's and did not get any of these tests at all. So it's definitely a mixed bag. What Alzheimer's disease is not is normal aging memory moments like misplacing your keys, diabetes or related to diabetes, which is a common misconception. The catch-all term for dementia, it's a type of dementia. Dementia is a condition, and Alzheimer's is a type of condition, and Alzheimer's is a disease. It is not caused by aluminum or medications, so your deodorant is not giving you Alzheimer's. Dementia or normal aging memory loss, which is it? How do you know? Dementia itself is not a disease. It's a general term for decline in mental ability severe enough to interfere with daily life, while Alzheimer's is a specific disease and the most common cause of dementia. What are the causes and risks? There are known causes, and there are still those that are being questioned. And of course, there's a lot of myths, which we briefly discussed. AD is a largely risk-related disease occurring after 65, being older than 65 being the risk. But there are other factors that one may not be able to control. Out of one's control is being older than 65, your genetics, some medical conditions, head injury, which you can do things to take steps to prevent that, and autism. Autism is one that's not typically listed on all of these sites. All of these sites have a bunch of, Mayo, WebMD, and so on, Alzheimer's.org. They all have the same basic lists for diagnosis, cause, risks, and so on. But for some reason, autism isn't listed that commonly. Obviously, the Alzheimer's Association did list it. Lifestyle choices can also help offset AD, but they can't prevent it. There are demonstrated links between certain illnesses and AD. Um, diabetes is one, but diabetes does not cause Alzheimer's. Healthy lifestyle choices can help prevent some of those other diseases like heart disease, diabetes, and so on that contribute to worsening symptoms of AD. So really taking care of your heart is helps take care of a lot of other potential diseases, not just Alzheimer's. Factors you can control, learning new skills, not crosswords. Everybody thinks crosswords are the way to go, but you have to actually learn new skills. Things like learning language, a new language, learning new music, or learning how to play an instrument, learning new songs, learning how to play a new game. That's especially good because you're using your body too. Regular exercise has been shown to directly affect the progression of Alzheimer's and help offset people before they would get symptoms. Quitting smoking, quitting drinking, eating well, heart healthy or Mediterranean diet is highly encouraged for both heart health and for Alzheimer's disease, as well as many other diseases. Having a healthy weight helps all of those things as well. And good sleep, quality sleep is really important for letting everything heal and have the most metabolic beneficial effect. There are a lot of sociocultural factors with a lot of diseases. Alzheimer's is not excluded from that factor. I rarely see on these sites discussions, these common disease sites, about the sociocultural status and factors that affect diseases, but it's really, what's the word I'm looking for? It's quite a wide-ranging issue. So medicine does delve into factors like poverty or wealth, minority populations, care and access to care and doctors and medications, education levels, and all of these things affect detection, prevention, and treatment of many conditions, definitely including Alzheimer's. Across the board, these areas are proving detrimental to populations that are underserved. So minority communities, poor communities, they tend to suffer more from most conditions because of a lack of detection or education about prevention and so on. And it's really important. Individuals with pre-morbid higher function supports are able to compensate for early disease changes to a greater degree and thus present later. Consequently, when well-supported patients eventually do present, they tend to have more marked morphological changes on imaging, meaning they have already progressed further, but their lifestyle um, has helped them to mitigate some of the symptoms. That's from Knipe and Gaillard in 2011, but they continue to have research posted on Alzheimer's. So how do you diagnose Alzheimer's? It's really hard because there are a lot of different factors that are parts of lots of other conditions, and there is a little bit of memory loss as we age, especially after 65. So diagnosis is a tricky situation, and imaging is fantastic, but it's not very affordable. So there are a lot of questions that practitioners will go through in order to diagnose Alzheimer's. Practitioners assess your overall health first. They do a physical, they get your history, including genetic. They assess your overall physical and mental functioning as well as lifestyle factors. Then they perform neurological exams if it looks like it's a factor for an individual. But those include things like, in person checking reflexes, checking coordination, listening to speech, and response to speech, checking a person's senses. Providers will look for other conditions that are easier to diagnose that might affect memory before looking at Alzheimer's. Of course, they'll keep it in mind, especially if they're getting anecdotal reports from family. Brain imaging is a part of the neurological assessment, but it is cost prohibitive and it's not the primary measure. Imaging is done with MRI and CT to rule out other conditions, and PET scans see the beta amyloids in tissue related to tau tangles. Microscopy can see actual amyloids and tau tangles, and there are a lot of other imaging situations and ways that imaging shows Alzheimer's. It shows those physical changes in the brain. But we will discuss more of that later. Beta amyloids and tau tangles characterize AD and lead to neuron destruction. The only definite way to diagnose Alzheimer's is with a brain biopsy. Obviously, you're not doing that with your loved ones while they're alive anyway. And it's not done post-mortem very often because why? Unless it's part already of studies or it has been accepted into that. So clinical and neuro assessments are usually the course, as discussed above. A newly tested biomarker using CSF, cerebral spinal fluid, can be utilized more affordably and early on and allow for targeted treatment before the tangles occur. This is absolutely huge. It's a very big deal, and it might help with cures. And but it's been out there, but it's also new that they've come up with this way to actually affordably possibly look at Alzheimer's neuron treatments. It's unclear how available it actually is, though. I haven't been able to find that information, but I am seeing a lot of news about it popping up, partly because of my searches, but also because stuff's really happening, and this is really exciting. Online assessments are not diagnostic, and they're unreliable. People are definitely warned away from taking some online quiz they found on Google because it's a really complicated thing to diagnose, and it can easily get misdiagnosed, which could put people down wormholes and in the wrong directions in both ways, whether for or against discovering Alzheimer's. Some of the key signs are the amyloid plaques and the tau tangles. Again, you don't really necessarily see those in preliminary investigations into whether someone has Alzheimer's. But clinical and neurological assessments will be performed along with with the assessment of your progressive decline in memory. Classifications are definite, possible, and probable. Imaging, blood, and CSF analysis and a mix of methods will be employed. More signs and symptoms. According to Lisa Genova, neuroscientist, everyone remembers more events for formative years better than more recent events. In other words, the older we get, especially whether you have Alzheimer's or not, or dementia or not, you remember things from your formative years, significant events, more than you remember more recent events. So when your grandpa keeps telling stories from his youth, but forgets what plans you made last week, that's pretty normal aging memory. Forgetting where your keys are, that's pretty normal. It's when they don't remember that you just now made a plan and we're supposed to be leaving in an hour that's not a normal memory event. So, or a significant event like having gone to a wedding last week or having a wedding coming up in 2 days of a grandchild, or forgetting the name of someone they know, or using a word for something that isn't the right word. Those are more significant. Symptoms include trouble focusing, a hard time doing ordinary activities, feeling confused or frustrated, especially at night, dramatic mood swings, outbursts of anger, anxiety, and depression, especially if this is not typical of this person, feeling disoriented and getting lost easily, physical problems such as an odd walk or poor coordination, trouble communicating. People with Alzheimer's might forget loved ones, how to dress, how to feed themselves, or how to use the toilet, and on and on. They also have a hard time learning new things. So a big part of Alzheimer's is imaging, but just to emphasize one more time, it's not typically used for diagnosis. I don't know if richer people can have that or people, facilities with big grants. I don't know. Again, it makes you ask that question about access and availability, especially to populations that aren't privileged. But imaging can show the beta amyloids in PET scans and MRIs, as well as tissue changes associated with tau tangles, as I mentioned before. It can be prohibitively expensive and is most often employed in research, as opposed to individual treatment. The combination of clinical assessment and patient history is the main route of diagnosis. As research for AD continues, more baseline images are available. PET FDG shows significant brain metabolism differences at different stages very clearly. MRI can show the degrees of brain shrinkage and where it's predominant, but you're not getting that baseline of that person's. You're not getting their brain when they were younger and didn't have brain shrinkage. So there are two links here that in the physical PowerPoint lead to really cool imaging. You can see CTs, MRIs, PET scans on a 3D scale. So you can like click on the side of the image and scroll through the brain. They're really neat. And then there's some microscopy brain imaging too that's available on these links. So click on these if you get the physical one because they're pretty cool to look at. They're just fun. So this is a series of PET scans for a healthy, mildly impaired, and an Alzheimer's disease person. You can see the green spots are where Alzheimer's is really developing, the green and yellow. And so it's really clear. But again, people don't just get to go have PET scans. This is an amalgam that Van Alstyne and others had put together with this imaging group, BioRender, of different types of, so one's a CT, one's an MRI, and one's a PET. And they're different. Two of them are two different types of PETs. Three of them are. So it's pretty cool to look at the differences and how it looks. This, I think that's actually a microscopic image there that they're looking at. Oh, no, I'm sorry, it's an MRI. But they're not just guessing. They're not just saying, yeah, that looks smaller, or that looks like an Alzheimer's sized brain. They actually have a scale and a standardized system by which they measure. And they go in and they physically use the little digital measuring tool and measure those, measure the regions, largely in the hippocampus, but in all areas affected, between the sulcus to measure what looks like depth. They have a way to calculate the depth, also based on the width of the fissures. So pretty neat and important to understand if you're really looking at imaging. Another PET with showing differences. Look at the huge gap in Alzheimer's. Wow. And then this is a really old one, but again, this is a way that they're actually trying to measure volumes and color coding to measure those volumes. But a neat image too. This is a wheel of all the different types of microscopic imaging, which is a whole other world. And I didn't take the time to understand microscopic imaging. It definitely doesn't happen commonly and on just basic diagnosis. It seems like that's still very much a research side of imaging for Alzheimer's disease. But these are neat to see. It's neat to see all the different types. And, that they're looking at the microglia, whatever. They're looking at the amyloids. They're looking at action with, what's the word I'm looking for? The phagocytosis. And it's pretty cool stuff. I would definitely like to look at it more myself. This is evolution of beta amyloid plaques, diffuse and normal glial and synaptic responses, microglial cells activated and synaptic loss, neuritic plaques, and end-stage plaques. So these are microscopic views of those different stages of plaques and the tangles, but you're seeing the plaques. Again, the tangles are harder to see. You can see tissue tangles more with those. I mean, tissue changes more with the tangles, tau tangles. But anyway, this is interesting, and that you can actually see this without contrasted imaging. So for prognosis and follow-up, it cannot be cured, not yet, but there is some hope with that CSF biomarker testing. Certain behaviors and medications can help delay onset or slow progression. According to Johns Hopkins, 8 years is the average time people survive after symptoms appear, but it can be as long as 20. And all of that's very variable. How soon are you noticing those symptoms? How soon are you deciding that's not just normal aging memory loss? And here we go. This is the beginning of Alzheimer's. If you have early onset, you have a distinct gene that you get tested for, but that's not a part of this discussion at all, because that one's much easier to know about. And not typical of Alzheimer's. Usually it's after 65, and early onset is 50 to 60, like 9. So understanding the basic stages can help in care and treatment and planning. As AD progresses, follow-up care involves regular doctor visits to assess progression, but more to assess patient needs and how medications or living situations need to change. Late stages of AD usually require full-time care and observation for safety reasons. Many late-stage Alzheimer's patients are in lockdown facilities to prevent wandering, for example. Actually, almost all late-stage Alzheimer's patients, if they're in a facility, they are in a memory care unit, partly because of the wandering and and they don't know where they are or what they're doing and can't find their way back and so on. So those factors really do require care in a facility. It's really hard for someone in their home to control whether an Alzheimer's patient might wander outside. They aren't able to necessarily know where they are, or if they're trying to cook, on a stove with paper instead of a pan, or so many possibilities. So eventually, even though most people want to keep people at home for as long as they can, most people do need to go to a facility, and often a nursing facility, where other things and diseases can be treated that have come about. So the stages are early, things like name recall, recent events, losing valuable objects, not knowing where the cell phone went, difficulty remembering plans made, especially if they're new plans, not typical plans. And you often have to tell them over and over and over again before, this is even at early stages, before they even remember exactly where and when the new plan is. They do definitely start to demonstrate issues with organization and paying bills. And that this early part is really hard, because often just typical aging memory loss happens in there too. Did those things happen? They have a harder time paying their bills and focusing. So a lot of people aren't getting care for Alzheimer's at the early stage because nobody's really sure, and they usually can carry on a conversation as well as most people. I mean, some people who definitely don't have Alzheimer's can't remember what you said to them 2 minutes ago. So it's often easy to miss at early stages. Mid is the longest, and it starts that's when you really start to notice troubling um, events occur. They have increased trouble remembering things that have already happened, big events that are supposed to happen. They really have a hard time learning new things, but not just learning new things, also trying new things. Like if you tell them, let's go to a new restaurant, they can't wrap their head around it. Um, for example, they have trouble planning. And they definitely aren't able to do things like planning that dinner party anymore, and or they have a really hard time with it when they do. And things get left out that usually they wouldn't, like, that secret recipe apple pie passed down in the family. Um, they have a much harder time reading and writing and really have issues with numbers. Like numbers are really hard. And they often will, at least I've seen, that they will say, "Oh, my hand's really hurting. Can you write that for me?" Or "I can't see. I'm really tired." What does this say? Um, they might start forgetting the names of people they know, not their kids yet. They don't, but they will forget, or they'll look at someone they know and not even know and not recognize them in the moment. They will know them, not like they where where you hear about how people don't recognize their own kids. They might see someone that they see every week and not even realize it's them for a few minutes, for example. They definitely have more difficulty with daily tasks, but again, you may not be sure. They could start getting moody or violent or intolerant where they didn't before, or where that wasn't typically how they are. They don't tend to go, that's not the type of dementia where they tend not to go to that happy side of dementia that some people get. It tends to be more of an anxiety, less happy. Um, and then, yeah, the restlessness, anxiety, they have a thing that they call, um, um, sorry, spacing, that they call night. I can't remember. I just spaced it. Sorry. But it's really typical for them to get more agitated in the evening. And then they can start wandering and get lost and generally be able to find their way home. But that some of that getting lost can start to happen. At late stages, definitely they can get lost easily. They definitely aren't able to make plans. They could have difficulty with eating. They could forget how to swallow. Um, they can forget how to walk right, and they might still walk, but walk funny. They can lose control of their bowels or bladder. They have less ability to converse or express needs or thoughts. They need help with a lot more tasks, if not all tasks. They're often unaware of their surroundings. They do start to forget who people are, or they might mistake their son for their brother, or they might know that someone is someone important in their life, but not really how. Um, and they're a lot more likely to get infections, pneumonia, and other illnesses. In the late stages, as those things start to decline, many other body systems start to decline. So for treatment, care, and follow-up, there are a lot of degrees, and there's the medical side, and there's the facility side, and there's home care. Basic treatment medically, they give you medications for treatments like seizures, anxiety, depression, shakiness, inability to sleep, violence even. My father-in-law definitely got very violent, and a lot of that was anxiety based. So they kept changing his medication to help control that. Um, they get inhibitors during early stages if it's caught that early, to help that flow a little bit more. There's memantine for moderate to severe issues that control particular cell communications, but I'm not clear on what that is. Some people get IV medications every other week or every few weeks to help slow decline. A lot of that, there are a lot of clinical trials on that. And there seems to be some really good progress, but there's a lot of variability there. There's new research toward a cure. Amyloid beta plaques have been shown to reduce with monoclonal antibodies. So I think that's actually part of the CSF biomarkers is they see that and they can treat monoclonal antibodies and prevent that progression from the beta amyloids to the destroyed tau tangles or the tau destroying tau tangles. Excuse me. So this is really exciting. I mean, really exciting. The phagocyte, they do phagocytosis and they start eating that stuff before it can start creating the changes in the tissue. So that is so awesome because a lot of us may be facing this, and that's very scary. Um, Treatment of other conditions, like I mentioned before, can arise as the person progresses. This is what I was mentioning before about the monoclonal antibodies. So you can see in the first side, the first column, they they are they are attacking basically and kind of disentangling these amyloids, and then the microglia come in and they start to eat those damn amyloids. Sorry. Not professional language, but it's really cool. You can see in the third column where there they are, and in the fourth column, they've been gotten eaten up. So I love this. I think this is really cool and interesting. Um, and I hope it's something that's really going to start working for everyone and be accessible to everyone. The caregiving side is super difficult. People, like I said, many people really try to keep their family members at home for as long as they can, and then they either burn right out because not many people understand how hard it is to care for them, and how many factors are affected by a person who doesn't know what things are or where things are or how things are anymore. Their personalities change, and it's hard to sort that from um, what's an issue and what isn't, what's safe, what isn't. Um, a person you might think they can drive just fine. Well, guess what? They can't even remember how to get into reverse. I've definitely been in that experience, and it's very scary. Or they may not understand that there are appointments in 3 hours, but they want to go right now because they don't want to miss their appointment, and you can't explain it to them for anything. So early stages just require monitoring, self, friends, and family, hopefully providers involved at this stage. But again, usually early stages, people can't tell, especially people who don't see the person on a daily basis. They just think, I have great conversations with them, they're fine. Um, so what? They forgot something. Big deal. I forget where my keys are all the time. And people say that. They literally say those words about parents and family who are coming up with this disease. And sure enough, a year later, that person's in a facility. It can happen fast and it can happen very slowly. And it can speed up after a while, or it can start to maintain for a while. So it's a very difficult disease for families to wrap their minds around, and even practitioners, because nobody wants to start disrespecting their parent and treating them like a child and treating them like they don't know what they're doing. You want as much as you can to leave their self-respect intact. And so everybody's hesitant to step in there and go, you don't know what you're doing. And of course, hopefully you would never do it like that. Mid stages, you're monitoring. You might have a homemade come along just to help with regular checkups and to help with daily tasks like some cooking, some food prep. If people are aware and know that this is happening, there are ways to help the person accept because, oh, look, they can do the laundry. That's too, it's been heavy for you. It's been hurting your back. There are so many ways. You want to be honest, but there are also other ways to just help them get help. In the late stages, some do opt for facilities fairly quickly, but again, most people opt for in-home assisted care. And often people even resist that, the assisted care. But conditions, medical conditions, and the wandering and other issues that come up, other conditions and diseases that come up can prohibit uh, the ability to leave a person at home. Although there are lots and lots of support organizations to help keep a person at home if that's what people want. This is a CDC link to a care plan. I highly recommend this link to anyone who is starting to deal with the reality of Alzheimer's in their life. Um, I mean, it might get disbanded, but and removed from the website. But a care plan is huge because it just gives people a way to have control and to make a plan and to make the progression of the disease easier on themselves and on their loved ones. One important note I found in my research about Alzheimer's is that researchers are really tuning into the fact that Alzheimer's patients often can't express pain. They might not even be able to identify it. So they could start, and some of them can't even speak anymore, so they can start acting out or not eating because it hurts, and they're not able to tell someone. And I mean, those are just a couple of examples. But a lot of times behavior does get worse if a patient is in, and they've been able to determine this, that some behaviors are associated with pain and an inability to express that to caregivers. So it's been noticed that medical practitioners might dismiss some home caregivers' concerns about these things who know the person well, and have an idea that something isn't aligned with their usual, albeit changing behavior. So, Kowalik and Denning really have made a case that it is really important to understand that because it can help offset so many difficult things for the patient and for caregivers. So, so really, it's important for that to be noted and well understood at clinics and where practitioners and caregivers are trying to help AD patients. Prevention, it's not entirely preventable, but you can slow it. You can slow onset and you can slow progression. That whole thing comes in again with populations, sociocultural factors. So always keeping those in mind, people who are poor, people who don't have access, people who aren't informed and aren't in the kind of communities that get informed about good diet and so on. They can really suffer unnecessarily. But aside from that, overall ways of prevention or at least delayed onset, there are factors that can be controlled. As mentioned before, learning new skills, a new language, a new instrument, a new sport, all of these things really help engage the brain. Regular exercise. Uh, it can just be walks. Walks have been shown to help improve health, mental and physical health across the board, across diseases, across people's lifestyles, across mental states in people, but other exercise too, of course. Smoking, drinking, all those things, processed foods, those are all considered things that help aggravate and prevent the height of functional metabolism, which metabolism is a huge part of keeping cell growth healthy, and cell life healthy, cell metabolism healthy. So eating well, again, things like heart healthy diet, eating lots of fruits and vegetables, eating a balanced diet, unprocessed foods, they help. Healthy weight always helps, and it also prevents other conditions. helps to prevent other conditions that um, aggravate the body's ability to recover. Um, the importance of sleep for, again, all aspects of life is really important, but it's super important for brain health. Um, the brain absolutely needs recovery time. Those cells need that recovery time, and if they're fighting something like Alzheimer's, it's absolutely critical. So help your loved one be able to sleep well, and it will help them have a better quality of life. Um, Keep them connected, or if you are facing Alzheimer's, stay connected. Being social, staying in touch with your family, doing things with other people has been shown to help keep people healthy. There is mentally healthy, cognitively healthy. There is a fun example of some nuns that were studied, and after they died, they were shown to have the beta amyloids and tau tangles to a strong degree. Not all of them, obviously, but many of them were, but none of them had been displaying symptoms. So was it their meditative lifestyle and eating everything from their garden? Maybe so. Maybe there's a whole lot to that. Um, so exercise and brain health. There are specialists that can help with this. I happen to be a nationally certified trainer in brain health and fitness. And there is a lot that you can do to offset just basic cognitive, normal aging cognitive decline, but there are a lot of studies out there that talk about how it helps with dementias and specifically Alzheimer's as well. It's a whole other side of research, but it's super interesting. And being physically healthy sure can't hurt. And being physically healthy also helps with mental health, both cognitively and emotionally. So, don't discount that. And you can look for brain health trainers. There are lots of them nationally, and there are ways to find them that are reliable and safe and use proven techniques. Um, and I forgot. But anyway, seek out these trainers. Uh, they can do nothing but improve your quality of life or your loved one's quality of life. And it doesn't mean they're having them run marathons. Oh, that's what I was going to say. Is it so far, almost all of the research is geared toward cardiovascular fitness. But there are things that they do for brain health that make people use their brain in order to do their exercise. So it's kind of coordination, eye-hand coordination type things, which are really hard to explain in this context, but it's really neat stuff. So if you or someone you know is facing Alzheimer's, this is a great way to just overall increase your quality of life and hopefully delay some of that onset and the degree of onset of Alzheimer's. So how can we remember this disease? Um, you don't have to remember it. Forget it for now because um, if it's true that 1 in 3 people will have Alzheimer's, either you or someone you love or someone you need to care for will be affected by it. So you will remember it. Um, but in the meantime, eat well, exercise consistently, and get good sleep and help offset this horrible and just dehumanizing disease. Um, so much interesting information out there. I wish everyone well and that we get a cure soon. Thank you.